There was this sulfur protocol that you had mentioned. I think it's a high dose MSM and helpful, if I'm remembering correctly from our conversation, for bloating, distension, constipation individuals, but would love to hear more about this.
Yeah, so this was from Dr. Janelle, and she presented this at the Gastro ANP conference in the fall of last year, 2023. So this is a wonderful gastroenterology conference for any practitioners listening. It's the Gastroenterology Association of Naturopathic Physicians, our annual conference. It's GI focused only. I love it. It's my favorite conference. Um, and so we had her come. I'm on the planning committee, so I'm also quite biased. I love getting all these wonderful speakers. You're going to be coming to speak for us.
Yeah,
So
I'm looking forward to it.
yeah, that's going to be great. So she gave this very fascinating lecture where she explained that she's been using this high dose MSM, high dose sulfur treatment for SIBO patients with a lot of success. And what would be the mechanism here? I don't know. It's a little wishy-washy in my mind. I'm not sure I care, but the mechanisms put forward were that it's antimicrobial. It is for sure, and also that many people have a sulfur deficiency. Correcting that can correct many things. And one of the things sulfur does in the body is it's part of our structural bonds um, in our tissues. And so when we can get those tissues strengthened, we might be able to affect motility and the migrating motor complex also, theoretically. Uh,
And I mean, MSM is used for joint pain, right?
that's right.
Traditionally, as I understand it. Yeah.
So what
So
she does
makes sense.
is she titrates people up from anywhere from a pinch to you know I don't know, like a half a teaspoon, and then gets them up to the full dose, which is 30 grams if I'm not mistaken, and I think it's about 2 tablespoons. Let me see if I just want to double check so I'm not saying the wrong thing here. I'll get to it right here. Let me see here. Here it is. Yeah, 30 grams. Yep, 2 tablespoons. And then you do that for 2 months and then step it back down to either being off of it or a maintenance dose of maybe around 2.5 to 5 grams a day. Some people will need that ongoing, others may not. She also does some other things. She removes raw foods, cruciferous and allium vegetables and legumes during that time. And she does warn that die-off can occur because it is antimicrobial. So there are people that deal with that. And then she reintroduces the foods when she goes back down to the maintenance dose. And as you said, she says it works best for the chronic constipated, chronic bloated type of patient who will feel better when they pass gas. That gas comes out like they have fermentative gas accumulation. That's what the bloating is from. And she just shared case after case of success, and we were all really excited about it. So, my friend and colleague, and also you've had her on, Dr. Alana Gurevich, she started doing it in clinic with her patients. She really wanted to see how well this was working or would work, and she did it last I heard on about maybe 30 patients, and has had very good success. That it worked for most, but not all. And she was focusing it on the chronic constipated, chronic bloating cases. She's now switching over to trying it on diarrhea patients, SIBO patients, and we don't know how that's going to go yet. But basically, the bloating is coming down and the bowel movements are occurring. So, for whatever reason, I don't know, but I'm so grateful to Dr. Janelle for sharing this interesting, different, new treatment.